In this module, we'll discuss another practical aspect of brainstem auditory evoked potentials, and that is how to draw and interpret latency intensity curves. A latency intensity curve can be used to differentiate a sensorineural hearing loss from a conductive hearing loss. We do not do this in our pediatric lab. However, it's often done in adult labs where it's easier to obtain the values needed for the curve. Also, it's important for you to understand how to create and interpret this graph for the exam. In a latency intensity curve, the stimulus intensity level in dB/SPL is plotted across on the x-axis, and the absolute latency of wave 5 obtained from testing the patient is plotted on the y-axis, or the vertical axis. The normal limits are usually marked on the plot, and they come from standard lab norms or standard norms in the literature. A brainstem auditory evoked potential threshold recording is obtained. This is where the patient is tested at a number of different decibel levels, and the latency of the wave 5 is tracked for each of the decibel levels. You will see in the plot on the left that the wave 5 is marked by a dark bar, and it's marked for each of the different dB levels, which are marked on the right side of that graph. And so you'll note that as intensity decreases, that is, as the stimulus becomes more quiet, the amplitude of wave 5 becomes later and smaller. From the tracings on the left, the values of the latency of wave 5 are acquired, and then these are plotted on the graph on the right. And so we see the latency at 10 decibels, for example, in the lower part of the left-hand tracing. And so we can mark the wave 5 value as it would be. And then we continue to mark the wave 5 values for each of the different decibel levels. If the brainstem auditory evoked potential study is normal, then the acquired values, the ones marked by the asterisks, will fit within the range of the normal limits. However, if the values of the wave 5 latencies, when plotted by intensity or loudness, as shown in this example by the asterisks, fall in a different kind of pattern, what we see here is that the asterisks fall outside the normal limits range, but they fall in kind of a straight line. And so when we see this kind of pattern, it's suggestive of a conductive hearing loss. If there's a conductive or peripheral hearing loss where the sound cannot get through the outer and middle ear, then there's an overall increase in the latency of wave 5, and this happens fairly equally across all intensities. And so this causes a shift of the entire curve upward from the normal range. In a different example, if the wave 5 latencies are plotted against intensity, as shown in this example with the asterisks, if the asterisks fall in a pattern where at high intensities at 80 and 90 dB, the wave 5 is only slightly delayed. But as the sound becomes quieter at lower intensity levels, the latency dramatically increases, and at low intensities, the wave 5 is not seen at all, it's absent. This kind of pattern, kind of a hockey stick pattern, is suggestive of a sensorineural hearing loss. So pause the video here and try this quiz question. In this question, you are asked to plot a latency intensity curve for two different patients. Identify which of these two patients has a sensorineural hearing deficit and which patient has a conductive disorder. So pause the video here, draw your plots, and when you're ready, restart the video. And so here is what the plots would look like. In this graph, patient 1 is plotted in blue, and patient 2 is plotted in orange. Patient 1 shows a wave 5 latency that disappears in the lower intensities. This suggests a sensorineural hearing loss. Patient 2 shows a wave 5 latency that is increased equivalently across the intensities, and this suggests a conductive hearing loss. Therefore, patient 1 has a sensorineural hearing loss, and patient 2 has a conductive hearing loss.